Welcome to my channel. In 1965, the first case of dengue fever was identified in Bangladesh. At that time, this disease was known as Dhaka fever. However, since the year 2000, dengue fever was started to spread more widely. In 2023, up until now, 650 people died of dengue fever, surpassing all previous records. Yesterday I saw a news report and I was shocked and my heart sank when I learned that two children aged 9 and 7 from same family died of dengue fever. Dengue fever was affected the most vulnerable, including women and children. Even pregnant mothers are not safe from its grips. Currently, hospitals are overcrowded and doctors are struggling to cope with the increasing number of patients. Therefore, if you can receive initial treatment at home, it may be help to reduce complication of dengue fever. So, in this video, I will discuss about why does dengue fever occur, what are the symptoms of dengue fever, why do people die from dengue fever, do's and don't do's during dengue fever, and what can we do to protect yourself from the dengue fever. So, let's get started. Why does dengue fever occur? During the rainy season, water accumulates in crevices and coconut shell and a mosquito is born. The name of the mosquito is Aedes aegypti. This mosquito, often referred to as a tiger mosquito due to the white stripes on its legs, is the primary vector of dengue virus. Aedes mosquito can also transmit other diseases like chikungunya, Zika, and yellow fever. The dengue virus has 4 serotypes including DEN1, DEN2, DEN3, and DEN4. Currently, DEN4 is known to responsible for higher number of infections. Now, let's take a look at the symptoms of dengue fever. It is important to note that dengue symptom can vary and in many cases there may be no symptom at all. Typically, dengue symptoms are similar to those of other viral fevers, but some common signs including number 1. High fever. Dengue fever often begins with a sudden high fever which can reach up 103 to 108 degree Fahrenheit. Number 2. Along with the fever and severe headache, eye pain, especially pain behind the eyes, can occur. Number 3. Intense muscle and bone pain can be experienced. The pain can be so severe that feel like the bones are breaking, and this is why it is sometimes referred to as backbone fever. Number 4. Nausea and vomiting as well as abdominal pain can also be present. Number 5. Within 3 to 4 days of being infected, the rash with a small red spot can appear on the skin. Although this symptom is not commonly seen with the current variant. Number 6. In addition to this symptom, physical weakness may be experienced. If you exhibit symptom of dengue fever, it's essential to get tested to confirm the diagnosis. Dengue fever can typically be identified through the 2 common tests. Number 1. Dengue NS1 test. These tests should be conducted within 72 hours of the onset of symptoms. If you test during this time frame, it will likely a positive result of dengue. Number 2. Antigen antibody test. If more than 72 hours have passed since the onset of symptom and NS1 test is negative, an antigen antibody test will be required. It is important to note that sometimes the NS1 test may show negative result, leading some to mistakenly believe they do not have dengue. In such case, it is crucial to consider the timing of the test relation to when symptom first appearance. Additionally, a complete blood count or CBC test should be conducted to check platelet level because dengue fever can cause decrease in platelet count. Now, let's discuss the treatment of dengue fever. Before we discuss the treatment of dengue fever, it's crucial to understand why people can die from dengue. If you can grasp the complication of dengue fever in the body, it will be easier to take the necessary steps. We know that the dengue fever, the platelet count in patient is decreased. However, even when the platelet level drop, the patient does not necessarily become critical ill. The critical situation arises when the plasma leakage occurs in dengue fever. Let me explain. An average adult body contains approximately 6 liters of blood. The blood consists of plasma fluid and blood cell. Blood cell consists of 55% plasma, while the remaining 45% of blood cell. Roughly 55% of plasma and while the 45% blood cell. Plasma 90% is water and 10% protein and other substance. Within 45% blood cell including are white blood cell, red blood cell and platelets. Initially in dengue fever, the platelets count of blood is decreased, a condition known as thrombocytopenia. Platelets in the blood have essential role of helping to clot blood, prevent bleeding. When there is an excessive decrease in platelet, it can lead to bleeding within the body. Two critical factors contribute to severe dengue. Number 1. Thrombocytopenia. In dengue fever, the patient platelet counts decrease, making them more susceptible to bleeding. Number 2. Plasma leakage. Dengue fever can cause problem with the patient's blood vessel, resulting in plasma leakage out. This condition is known as plasma leakage. When the plasma leaks out, it can accumulate in the various body organs such as lung, liver, kidneys, leading to severe complication. Understanding this factor is crucial because low platelet and plasma leakage are two main reasons for dengue fever which can life-threatening. We understand that maintaining fluid balance is most important in dengue fever. Now, discuss the treatment of dengue fever. There is generally no specific treatment of dengue fever, and in many cases the condition resolves in its own. The primary focus on the treatment of dengue fever is manage the symptom and prevent complication. Here are some steps to take care of yourself or someone with dengue fever. Number 1. It is important to strengthen your mental resolves. Rest is essential. Make sure to get plenty of rest and avoid strenuous activity. Number 2. Rapid sponging. Number 3. Over-the-counter fever reducing medication like paracetamol can help to manage the fever and body ache. Follow the recommended doses instruction typically every 6 to 8 hours as needed. Number 4. Dengue fever can cause a decreased body fluids. So it is crucial to ensure that your body remains adequately hydrated. It's essential to stay well hydrated to help to maintain blood volume. This includes drinking coconut water, oral saline, fruit juice, soup and clear fluid. Number 5. Take anti-emetic if nausea vomiting is present. Number 6. Avoid certain medication. Avoid non-steroidal anti-inflammatory drugs or NSAID like aspirin, diclofenac, ibuprofen as they can increase the risk of bleeding. Number 7. Mosquito protection. Stay indoor to prevent future mosquito bites. This helps to prevent spread of virus to other people through infected mosquitoes. Number 8. You should remain adequately rested even if the fever has subsided. We often make the mistake of assuming we are completely healthy once the fever goes down. However, the 72 hours after the fever subsides can be the most critical time for the patient. During this period, the patient can face life-threatening complications. So, it's essential to prioritize rest and monitoring during this phase. 9. Regularly monitoring your platelet counts. This will help determine the severity of the illness. In this way, you can receive medical treatment at home. Now, discuss do's and don't do's during the dengue fever. Number 1. If you already have high blood pressure or are taking medication for the heart disease, consult a doctor immediately as this medication may need to be discontinued. Number 2. Avoid taking painkiller or anti-inflammatory drugs to reduce dengue fever symptoms, as they can cause harm. Number 3. Don't take any antibiotics without a doctor advice. Number 4. You can eat raw papaya, which has many benefits when living with dengue fever. Now let's discuss the dangerous sign of dengue fever. Number 1. Bleeding. If you notice bleeding from the gums, nose, blood in vomiting, black stool, seek immediate medical attention. Number 2. If your blood pressure and urine output decrease, go to the hospital immediately. Number 3. If you experience severe abdominal pain, frequent vomiting or bloated abdomen, seek immediate medical attention. Number 4. If you have difficulty breathing, persistent cough or swollen abdomen, go to the hospital immediately. These symptoms indicate that the patient platelet count is decreasing or that there is a plasma leakage, which can lead to dengue hemorrhagic fever and dengue shock syndrome. When you observe this symptom, understand that the patient platelet count is decreasing, which can lead to severe complications like dengue hemorrhagic fever or dengue shock syndrome. In such case, it is essential to go to the hospital immediately. In severe case, hospitalization may be necessary to closely monitoring the patient condition, provide intravenous fluid and manage the complication. In case of severe bleeding or very low platelet count, a blood transfusion may be required. Now, how to prevent dengue fever? Number 1. To maintain cleanliness. Discard used plastic containers, broken dishes and flower pots regularly, as they promote the breeding of mosquitoes. Number 2. Use mosquito net while sleeping. Number 3. Use mosquito repellent spray in corners of the house, on sofas and wardrobes. Keep the surroundings clean and tidy to prevent dengue, inshallah. We can remain dengue free by the following this practice. Hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.